Before you begin the Misdiagnosis Independent Test, I want you to do something very simple. Take a breath, relax, and don't worry about getting the right answers because this is not an exam and it is not a test to diagnose you. In fact, right at the beginning, I want you to remember four words: no diagnosis, only clarity. This experience is simply designed to help you look at something that is often overlooked: your own health story. You may be you may already have a diagnosis. You may have reports, prescription, years of medical history, perhaps even several consultations. But here is the question I want you to think about. Do you actually understand your story? Not just the name of the diagnosis. I mean, do you understand what happened, when it happened, how the story unfolded, what changed, what questions are still unanswered? That's what this test is designed to help you explore. You might be wondering, independence from what? Let me make that very clear. This test is not about becoming independent from your doctor. It is not about becoming independent from medicine. It is not about becoming independent from treatment. And it is definitely not telling you to stop or change any treatment. The independence we are talking about is different. It is freedom from confusion, from fear, from helplessness, from fragmented information, blindly carrying on a label, or not knowing your own timeline, and unanswered questions. The goal is to help you become a more informed participant in your own health journey. The test is very simple. There are 10 questions and it should take about 3 minutes. As you go through each question, don't try to impress anyone. Don't answer the way you think you should answer. Answer honestly. Your goal isn't to prove that you understand everything. Your goal is to discover how clearly I actually understand my own health story. So take your time, read each question, think about your own situation, and choose the answer that feels most accurate for you. And then comes the part I really want you to pay attention to. Your result isn't simply good or bad. You receive a misdiagnosis independence score from 0 to 100. And also you will also receive a misdiagnosis freedom audit showing 5 personalized areas and identifying your biggest opportunity for greater clarity. And there is something else waiting for you: a downloadable misdiagnosis independence map to help you see where you are now and think about your next responsible step. So don't rush through the questions just to get the score. The score is useful, but the insight behind the score is more valuable. And one more thing, there is there is no result here that should frighten you. This isn't designed to tell you you have this disease or you don't have that disease. It doesn't do that. It is a educational reflection experience. It doesn't diagnose or treat you, replace professional medical care, or give you a reason to stop or change treatment. Your healthcare decisions should continue to be discussed with a qualified healthcare professional or doctor. Also, come into this experience with curiosity, not fear. So, you are ready. Don't worry about being perfect. Don't try to guess what I want you to say. Just tell the truth about your story. Then look at your result. Look beyond the number. Share it on your social media. Read your freedom audit. Look at your biggest opportunity. Download your Misdiagnosis Independence Map and ask yourself one final question: how much ownership do I really have over my health story? Go ahead, take the free Misdiagnosis Independence Test. I will see you on the other side of the result. Your story is worth understanding.